Your heart is beating roughly 100,000 times today. That's 100,000 contractions that require energy, electrical coordination, and structural integrity. And right now, at the cellular level, your heart muscle is either being supported by the nutrients it needs to maintain that function for decades to come, or it's slowly deteriorating because those nutrients aren't present. The supplement industry wants you to believe that every vitamin and mineral is essential for heart health. They'll sell you formulas with 40 different ingredients at doses too low to do anything meaningful. But the reality is that there are only 3 supplements with robust clinical evidence showing they actually reduce cardiovascular events, improve heart function, and extend lifespan in human populations. Not in theory, not in isolated cell studies, in actual randomized controlled trials with real patients followed for years. What makes this frustrating is that most doctors don't discuss these supplements with their patients, even though the evidence supporting them is stronger than the evidence for many commonly prescribed medications. These aren't exotic compounds that cost hundreds of dollars per month. They're widely available, relatively inexpensive, and they work through mechanisms that have been mapped out in extraordinary detail. And the reason you probably haven't heard about them is that there's no financial incentive for pharmaceutical companies to promote nutrients that can't be patented. Hi, I'm Dr. Alex. I'm an emergency medicine doctor, and after nearly 10 years in the AANDE, I've treated thousands of patients with acute heart failure, myocardial infarctions, and arrhythmias. I've seen what happens when the heart's energy production system fails, when the electrical conduction breaks down, when the muscle tissue becomes too damaged to pump effectively. And in many of these cases, the deterioration happened gradually over years or decades because fundamental nutritional deficiencies were never addressed. Not deficiencies that show up on standard blood work, but deficiencies at the cellular level that impair mitochondrial function, increase oxidative stress, and accelerate cardiovascular aging. My goal now is to help people understand which interventions actually have evidence behind them and which are just marketing. The supplement industry is largely unregulated, and most products on the market are supported by nothing more than testimonials and cherry-picked studies. But there are exceptions. There are nutrients with legitimate clinical trials showing cardiovascular benefit, and those are what we're going to discuss today. Now, before we continue, I want to make you a promise. I promise to keep creating the most helpful videos I possibly can, grounded in actual clinical evidence and the mechanisms that determine cardiovascular outcomes. I'm not affiliated with any supplement company. I don't sell products. I'm here to explain the science so you can make informed decisions about your health. And all I ask in return is that you give this fairly new channel a chance and hit the subscribe button. If you get to the end of this video and you didn't think it was worth your time, or you haven't learned something genuinely useful about protecting your cardiovascular system, then feel free to unsubscribe. No hard feelings. But if you give me your time and your attention, I'll give you everything I've learned from over a decade in medicine about what actually works. So please help me out. Hit the subscribe button to help this channel reach more people like you who want evidence-based information about heart health. And let's continue. Before we discuss specific supplements, we need to understand what actually determines whether your heart stays functional into your 70s, 80s, and beyond. The heart is fundamentally an energy problem. Your heart muscle cells, called cardiomyocytes, contain the highest density of mitochondria of any tissue in your body because they require enormous amounts of ATP to sustain continuous contraction. Unlike skeletal muscle, which can rest between contractions, your heart never stops. It beats roughly 2.5 billion times over an average lifespan. That requires uninterrupted energy production. There are 3 primary pathways that determine whether your heart maintains its function or deteriorates over time. The first pathway is mitochondrial energy production. Your heart cells must continuously generate ATP through the electron transport chain. When mitochondrial function declines, energy production drops, and the heart muscle becomes less efficient at pumping blood. This shows up clinically as reduced ejection fraction, exercise intolerance, and eventually heart failure. The second pathway is oxidative stress and inflammation. The process of generating energy in mitochondria produces reactive oxygen species as a byproduct. These are chemically reactive molecules that damage cellular structures, including the mitochondria themselves. Your body has antioxidant defense systems to neutralize these molecules, but as you age, those systems become less efficient. The result is cumulative oxidative damage to heart muscle cells, blood vessels, and the electrical conduction system. The third pathway is endothelial function and vascular health. The endothelium is the thin layer of cells lining your blood vessels, and it produces nitric oxide, which keeps vessels relaxed and prevents clot formation. When endothelial function declines, your blood vessels become stiff, your blood pressure rises, and your risk of clot-related events like heart attacks and strokes increases. This pathway is critically dependent on specific nutrients that support nitric oxide production and protect the endothelium from oxidative damage. Now here's what most people have been told about supplements and heart health. Take a multivitamin for general wellness. Maybe add some vitamin C and vitamin E for antioxidants. Perhaps some calcium for bone health. And that's largely been the extent of the advice. The problem is that none of those interventions target the specific mechanisms I just described. Multivitamins contain dozens of nutrients at doses that are often too low to have therapeutic effects. And several large trials have shown that vitamin E supplementation in isolation does not reduce cardiovascular events and may even increase certain risks. What the research is now showing us is that cardiovascular protection requires targeting the specific pathways that determine heart function. You need nutrients that directly support mitochondrial energy production, that reduce oxidative stress at the source, and that maintain endothelial function. And there are only a handful of supplements with robust clinical evidence demonstrating those effects. The first mechanism we need to understand is the electron transport chain, which is where ATP is actually produced in your mitochondria. This chain requires specific cofactors to function properly. Without those cofactors, energy production becomes inefficient, reactive oxygen species increase, and mitochondrial function declines. One of the most critical cofactors is coenzyme Q10, also called ubiquinone. Coenzyme Q10 sits in the inner mitochondrial membrane and carries electrons between complexes in the electron transport chain. It's absolutely essential for ATP production, and your body's ability to synthesize coenzyme Q10 declines significantly with age. Research published in journals like the European Heart Journal has demonstrated that coenzyme Q10 levels in heart tissue decrease by approximately 50% between age 20 and age 80. This decline parallels the decline in mitochondrial function and correlates with increased cardiovascular risk. Studies have also shown that certain medications, particularly statins, which are among the most widely prescribed drugs for cardiovascular disease, further deplete coenzyme Q10 levels because they inhibit the same metabolic pathway that produces both cholesterol and coenzyme Q10. The second mechanism involves the amino acid homocysteine, which is a metabolic byproduct that accumulates when certain B vitamins are deficient. Elevated homocysteine damages the endothelium through oxidative stress and promotes inflammation and thrombosis. It's been established for decades that high homocysteine levels are associated with increased cardiovascular risk. The body metabolizes homocysteine through pathways that require vitamin B6, vitamin B12, and folate. When any of these vitamins are insufficient, homocysteine accumulates. The third mechanism is nitric oxide production, which, as I mentioned earlier, is critical for maintaining blood vessel flexibility and preventing clot formation. Nitric oxide is produced from the amino acid L-arginine through an enzyme called nitric oxide synthase. But this enzyme requires specific cofactors to function properly, and the availability of L-arginine can become rate limiting, particularly in people with existing cardiovascular disease. Studies have shown that supplementing with precursors to nitric oxide can improve endothelial function and reduce blood pressure. What becomes clear when you look at the actual mechanisms is that cardiovascular health is not about taking a generic antioxidant or a multivitamin. It's about addressing specific metabolic bottlenecks that develop with age or are exacerbated by medication use, poor diet, or genetic factors. The nutrients that actually make a difference are the ones that target these bottlenecks directly. And there's something else that's important to understand. The supplement industry is filled with products that claim cardiovascular benefits based on preliminary research or mechanistic plausibility. But when those products are tested in rigorous clinical trials, the benefits often disappear. The three supplements I'm about to discuss are different. They have been studied in randomized controlled trials with hard endpoints like mortality, heart failure hospitalization, and cardiovascular events. The evidence is not perfect, but it's stronger than what exists for most supplements on the market. Here's the mistake that most people are making, and it stems from a fundamental misunderstanding of what supplements are for. People treat supplements as optional add-ons to a standard diet, something you take if you happen to remember or if you're feeling particularly health conscious that week. But for certain nutrients, particularly the ones that support cardiovascular function, deficiency is not rare. It's the norm, especially in people over 50. And that deficiency has measurable consequences that accumulate over years. Think about coenzyme Q10. Your body produces less of it as you age. If you're on a statin medication, your production drops even further. If your diet doesn't include organ meats, which are one of the few food sources with meaningful amounts of coenzyme Q10, you're not getting it from food either. So your heart muscle is operating with declining levels of the primary cofactor it needs to produce energy. And you have no symptoms, you don't feel it happening, but your mitochondrial function is deteriorating, your exercise capacity is slowly declining, and your risk of heart failure is increasing. The same pattern applies to B vitamins and homocysteine. Many people, particularly older adults and those on certain medications like metformin or proton pump inhibitors, have suboptimal B12 levels. They're not deficient enough to cause the severe neurological symptoms that show up in medical textbooks, but they're deficient enough that their homocysteine levels are elevated. And elevated homocysteine is quietly damaging their endothelium, promoting inflammation and increasing their thrombotic risk. This doesn't show up on routine blood work unless homocysteine is specifically measured, which it rarely is. This shows up in everyday life in ways people don't connect to nutritional status. You're more fatigued than you used to be. You assume it's just aging. You can't exercise as intensely as you could a few years ago. You assume you're out of shape. Your blood pressure has been creeping up gradually. You assume it's genetic or stress-related. But in many cases, these symptoms are partially driven by declining mitochondrial function and deteriorating vascular health, both of which are influenced by nutrient status. The medical system is not set up to address this. Doctors are trained to diagnose and treat diseases, not to optimize metabolic function through nutritional interventions. And pharmaceutical companies have no financial incentive to promote nutrients that can't be patented. So patients are left on their own to navigate a supplement industry that's filled with misleading marketing and products that don't contain what their labels claim. The result is that people either avoid supplements entirely because they don't trust the industry, or they buy ineffective products based on advertising rather than evidence. If you're realizing that cardiovascular health requires more than just avoiding bad foods and taking prescription medications, then please hit that subscribe button now. This channel is dedicated to explaining the metabolic science that actually determines health outcomes, not just repeating conventional advice. Now let's discuss the 3 supplements that have the strongest evidence for cardiovascular benefits. I want to be very clear about something before we start. I'm not suggesting that supplements replace medication, lifestyle changes, or medical care. What I'm saying is that these nutrients address specific metabolic needs that are often not met through diet alone, particularly in older adults. And the evidence suggests that addressing those needs can reduce cardiovascular risk. The first supplement is coenzyme Q10, and the evidence for this is substantial. Coenzyme Q10 is available in 2 forms, ubiquinone and ubiquinol. Ubiquinol is the reduced active form and is generally better absorbed, particularly in older adults whose ability to convert ubiquinone to ubiquinol may be impaired. The dosage that has been studied in clinical trials ranges from 100 to 300 milligrams per day. The landmark trial supporting coenzyme Q10 is the Q-Symbio study, published in the Journal of the American College of Cardiology. This was a randomized, double-blind, placebo-controlled trial of patients with moderate to severe heart failure. The patients who received 100 milligrams of coenzyme Q10 3 times daily had a significant reduction in cardiovascular mortality and hospitalizations for heart failure compared to placebo. The benefit was maintained over 2 years of follow-up. This was not a subtle effect, it was a clinically meaningful reduction in hard endpoints. Subsequent research has shown that coenzyme Q10 supplementation improves mitochondrial function in heart muscle, reduces oxidative stress, and improves endothelial function. Studies in hypertension have demonstrated that coenzyme Q10 can lower blood pressure by approximately 10 to 15 millimeters of mercury in people with elevated pressure. And research in statin users has shown that coenzyme Q10 supplementation can reduce the muscle pain and weakness that some people experience on these medications. The mechanism makes sense. You're providing the cofactor that your mitochondria need to produce energy efficiently. When mitochondrial function improves, the heart muscle can contract more effectively, oxidative stress decreases, and overall cardiovascular function improves. For people over 50, particularly those on statins or with existing heart disease, coenzyme Q10 supplementation addresses a real metabolic need. The second supplement is a combination of B vitamins, specifically B6, B12, and folate, for lowering homocysteine. The evidence here is more complex than for coenzyme Q10, but there are specific populations that clearly benefit. The key is to measure baseline homocysteine levels before supplementing, because not everyone has elevated homocysteine. Research published in the Journal of the American Medical Association examined trials of B vitamin supplementation and found that while universal supplementation did not reduce cardiovascular events across entire populations, supplementation in people with elevated homocysteine did show benefit. The effective doses are typically 2 to 3 milligrams of B6, 400 to 1,000 micrograms of B12, and 400 to 800 micrograms of folate. These doses are higher than what you would get from a standard multivitamin, but are safe and well tolerated. The mechanism is straightforward. B vitamins are cofactors for the enzymes that metabolize homocysteine. When you provide adequate amounts of these vitamins, homocysteine levels drop, typically by 20 to 30%. And when homocysteine drops, endothelial function improves and markers of inflammation decrease. For people with elevated homocysteine, particularly those with kidney disease, genetic variants affecting homocysteine metabolism, or those on medications that deplete B vitamins, supplementation makes biochemical sense. The third supplement is omega-3 fatty acids from fish oil, specifically EPA and DHA. The evidence for omega-3s is extensive, but has become controversial in recent years because some large trials showed no benefit. However, when you look at the data more carefully, the trials that showed benefit used higher doses of purified EPA and DHA, while the trials that showed no benefit often used lower doses or mixed oils. The Reduce It trial, published in the New England Journal of Medicine, demonstrated that high-dose purified EPA at 4 grams per day significantly reduced cardiovascular events in people with elevated triglycerides. This was a large, well-designed trial with clear results. The benefit was primarily in reducing triglycerides, stabilizing atherosclerotic plaques, and reducing inflammation. Other research has shown that omega-3 supplementation improves endothelial function, reduces blood pressure modestly, and may reduce the risk of sudden cardiac death by stabilizing cardiac electrical activity. The effective dose appears to be at least 2 to 3 grams per day of combined EPA and DHA, which is significantly higher than what most people get from diet alone unless they're eating fatty fish multiple times per week. The mechanism involves incorporation of EPA and DHA into cell membranes, where they compete with omega-6 fatty acids and reduce the production of pro-inflammatory signaling molecules. Omega-3s also support mitochondrial function and improve insulin sensitivity, both of which have cardiovascular benefits. Now, regarding practical implementation, if you're going to supplement with any of these nutrients, quality matters significantly. For coenzyme Q10, look for ubiquinol forms from reputable manufacturers. For B vitamins, methylated forms of B12 and folate are often better absorbed. For omega-3s, choose products that are third-party tested for purity and that provide at least 1 to 2 grams of combined EPA and DHA per serving. And critically, discuss supplementation with your physician, particularly if you're on blood thinners or other medications, because omega-3s and coenzyme Q10 can interact with certain drugs. This is not about self-treating cardiovascular disease. This is about addressing nutritional needs that support cardiovascular function alongside appropriate medical care. In emergency medicine, we treat the acute manifestations of cardiovascular disease, the heart attacks, the strokes, the sudden cardiac arrests. And in many of these cases, the underlying disease process had been developing silently for years. Mitochondrial function had been declining, oxidative stress had been accumulating, endothelial dysfunction had been progressing. And all of that could have been detected and potentially modified if we measured the right biomarkers and addressed the underlying metabolic needs. What I've observed in patients who optimize their nutrient status alongside standard medical treatment is that they often have better outcomes. Their energy levels improve, their exercise tolerance increases, their need for medications sometimes decreases, and that makes sense because you're supporting the fundamental cellular processes that determine how well the heart functions. The bigger picture here is that cardiovascular health is not just about lowering cholesterol or controlling blood pressure with medications. Those interventions are important and they save lives. But they don't address the underlying energy metabolism and oxidative stress that drive cardiovascular aging. The three supplements we've discussed, coenzyme Q10, B vitamins for homocysteine control, and omega-3 fatty acids, target those underlying mechanisms. They support mitochondrial function, reduce oxidative damage, and improve vascular health. The research supporting these nutrients is not perfect. No intervention in medicine has perfect evidence, but the trials that have been conducted show meaningful benefits with minimal risks. And for people over 50, particularly those with existing cardiovascular risk factors or on medications that deplete these nutrients, supplementation addresses a real physiological need. The populations with the longest cardiovascular health spans are not the ones taking the most supplements. They're the ones eating whole foods, staying physically active, maintaining healthy body weight, and avoiding smoking. Supplements are not a replacement for those fundamental behaviors. But when diet alone is insufficient to meet specific metabolic needs, targeted supplementation can make a measurable difference. So here's what I want you to take away from this. Not all supplements are created equal. Most of what's marketed for heart health has minimal evidence behind it. But coenzyme Q10, B vitamins for elevated homocysteine, and omega-3 fatty acids have legitimate clinical trials showing cardiovascular benefit. If you're going to invest in supplements, these are the ones with the strongest scientific foundation. If this video helped you understand which supplements actually have evidence supporting their use in cardiovascular health, then please subscribe to this channel. I'll keep creating content that separates genuine science from marketing and gives you information you can use to optimize your health. Thank you for watching, and I'll see you in the next video.